Karnataka, viewers, you'd remember Karnataka Chief Minister Siddaramaiah sparking concerns over COVID vaccine. After shocking incidents of cardiac arrests, the Chief Minister had raised a question. After 23 deaths were reported in 40 days in the Hassan district, the Chief Minister had asked, is there a link between these deaths and the COVID vaccine? He blamed hasty approval and distribution, leading to several medical experts coming out to slam him, saying that such doubts could be detrimental to public health if people start doubting vaccines. But now his own government's panel has ruled out any such link. An investigation by the expert committee constituted by the government of Karnataka has highlighted the growing public health challenge posed by the rise in sudden cardiovascular events. But it goes on to say that the observational study conducted at the Jayadeva Hospital did not find any association between premature cardiovascular disease and a prior history of COVID-19 infection or COVID vaccination. Now, this is, remember, in contrast to what the Chief Minister has claimed. The expert panel also said that most studies or reports published in the rest of the world have also not found any causal association between COVID vaccines and sudden cardiovascular events. On the contrary, COVID vaccination has been shown to be protective against cardiac events in the long term. It also mentioned that there is no single cause behind the observed rise in sudden cardiac deaths. It appears to be a multifactorial issue with behavioral, genetic and environmental risks. Remember, this is not related to the Hassan district heart attack cases alone. This was an observation study ordered by the government in the month of February this year after an activist raised the issue with the Chief Minister's office. But it's not just the state's own panel, viewers. The Union Health Ministry as well had allayed concerns, saying there is no evidence to suggest that COVID vaccine is causing sudden deaths. Citing extensive studies by the ICMR and National Center for Disease Control, the Health Ministry had said that the issue had been looked into by multiple agencies and that the claims were unfounded. Now the Congress finds itself on the back foot, claiming that the government just wanted clarity.
ಬರೀ ಹಾಸನ ಜಿಲ್ಲೆ ಅಲ್ಲ, ಇಡೀ ರಾಜ್ಯದಲ್ಲಿ ಈ ರೀತಿಯ ಆಂಟಿ ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಇಂದ ಆಗಿದೆ ಅಂತಕ್ಕಂತ ಹೆಚ್ಚು ಪ್ರಚಾರ ಏನು ಆಗ್ತಾ ಇದೆ. ಅದಕ್ಕೆ ತೆರೆ ಎಳಿತಕ್ಕಂಥದ್ದಕ್ಕೆ ಈಗಾಗಲೇ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಕಮಿಟಿಗಳು ರಿಪೋರ್ಟ್ಸ್ ಗಳು ಎಲ್ಲ ಬಂದಿದ್ದಾವೆ. ಮತ್ತೆ ನೀವು ನೆನ್ನೆನೂ ಕೂಡ ಟಿವಿ ಮಾಧ್ಯಮದಲ್ಲಿ ನೀವುಗಳೇ ತೋರಿಸಿದ್ರಿ, ಡಾಕ್ಟರ್ ಸಿ.ಎನ್. ಮಂಜುನಾಥ್ ಅವರು ಹೇಳಿರ್ತಕ್ಕಂಥ ಅಭಿಪ್ರಾಯ ಎಲ್ಲ ನೀವು ಕೂಡ ನೋಡಿದ್ರಿ. ರವೀಂದ್ರನಾಥ್ ಅವರು, ಈಗ ಹಾಲಿ ಇರ್ತಕ್ಕಂಥವ್ರು ರವೀಂದ್ರನಾಥ್ ಅವರು ಕೂಡ ಇವತ್ತೂ ಕೂಡ ಪತ್ರಿಕೆಯಲ್ಲಿದೆ.
It is not only in Karnataka. When COVID disease were going on in our country, rather in the whole of world, so many experts from various countries, as I remember from Germany, he has given a very specific statement that such kind of vaccine may be dangerous for the human being. So it is very good. I appreciate it. I congratulate Chief Minister Karnataka to constitute a committee, expert committee, to find out the truth. And if committee has submitted its report that it has not linked with the COVID, it is very good.
It has been observed by every single person, whether in India or elsewhere, that the number of heart attacks, the number of incidences of heart attack have increased exponentially ever since the vaccine has been introduced. And this is something which is unassailable, irrefutable, right? Whether there is linkage which the medical community knows now or whether it is not, the people are speaking about this issue, and it is necessary for the Chief Minister, when in merely 40 days, when 23 people have died and most of them are very youthful, then I think it is necessary for a detailed examination on the subject.
But the BJP says that the Congress must apologize for making irresponsible statements.
People holding high offices have to very carefully weigh the impact of their words. Now a panel in Karnataka is also concluding that there is no such evidence on what some of the persons in the political class were raising unnecessary allegations or reservations about the COVID vaccination program. I think it doesn't do justice to the larger issues that get impacted due to a stray comment here and there without appreciating the implications of that.
Well, Siddaramaiah is not able to back up with any credible evidences about what he's saying. He's just saying it because of the hearsay, and because of that the complete pharma industry can be in trouble, and especially we have a lot of exports which are being done by the pharma industry. But without any credible evidences, he can't accuse COVID vaccine for the heart attacks which are happening in Karnataka.
Let me go across to my colleague Imran, who's getting us more on this. Imran, one after the other, panels, researches and studies are completely refuting what the Chief Minister of Karnataka has said about the link between COVID vaccines and, the cardiac arrest cases that we are seeing across the country. This time, of course, the Congress government saying that we only wanted clarity after the entire claim has been refuted.
Well, yes, now the government's own panel has come out with this study that shows that there is no correlation between the anti-COVID vaccinations and the heart attacks. Now, there was a series of heart attacks, and now also another study has also been conducted to be conducted by the state government in Hassan district, where more than 30 people have died due to heart attacks. These reports of more incidents of heart attacks has created panic among people, and some even suggested the Chief Minister to see whether it's a link to the vaccinations. Now, this study, what we're referring to, is from the Jayadeva Hospital, which is conducted in the month of April and May, and they come out with a study after studying more than 100 patients of it, that there is no correlation between the COVID vaccination and the deaths due to heart attacks. Heart attacks is what the study has come out, and this is own government constituted panel. Just to rejog our viewers' memories, that there was entire controversy broke out over this. In fact, Kiran Mazumdar-Shaw and the ICMR even issued a statement saying that there is no correlation. The vaccinations are safe. Kiran Mazumdar-Shaw said that the statements of the Chief Minister were little creating panic among people, and they should have been little more measured. The Chief Minister said that on the retorting to Kiran Mazumdar-Shaw, that in the interest of the public, because he's also not just Chief Minister for one particular sector, but also for the entire public, and they have concerns because there were a lot of complaints and letters being written to the Chief Minister about this issue. So he has constituted a committee, and there is no harm in getting a research done, and if there is anything, they will only prove more allay the fears of the people there. Now, the report has come out and said that there is no correlation, but the minister also, the district in charge minister, comes out and says it's that the report has cleared by the clear bear, and it also helps them to present a clear point of view to the people. So, but over this entire politics, the BJP has targeted the state government, saying that they create the panic. Now the report, the own submission says that there is no correlation to that.
All right, Imran, thanks very much for joining us and getting us more details on this entire claim and counterclaim. Of course, now that claim of the link between vaccines of COVID and cardiac arrest